So how do we fix shoulder pain during the bench press? So I'm going to try to break this down and make it as simple as possible. I'm going to give you 4 steps to success, right? Number 1 is finding tolerable substitutions for the bench press and other aggravating movements in the gym, right? Step 2, strengthen the shoulder. Focus on the injured area and helper muscles for the bench press. So this would be the rotator cuff, serratus anterior, the pecs, delts, and triceps are the main movers in the bench press. Step number 3, we're going to progressively overload. We're going to start with a little bit of stress and we're just going to ramp up over the course of time, get stronger and stronger. And the last piece, step number 4, is to slowly transition back to your prior program. So we want to try to modify your program as little as needed, right? Start to slowly progress over the course of time and try to progress right back to where we were before the injury at your prior program. So, step 1. How to modify the bench press to continue training with shoulder pain. So our goal is to find the hardest and most similar bench press variation the shoulder tolerates well with minimal pain on a given training day. And the reason being is because we want to try to keep our program as similar as possible, because hopefully your program is well thought out, it's good for you, and it takes you in the direction you want to be from a fitness perspective. We don't want to move very far from that, because if we start moving farther from that, we're actually going to get worse results long-term from a fitness perspective. So we're going to try to get away with as much training as we possibly can. With that being said, here are the general guidelines for the movements that you choose. First and foremost, we want the pain to be less than or equal to a 3 out of 10 on a 0 out of 10 VAS pain scale. So 10 out of 10, worst pain you ever experienced, 0 to 10, 0 pain. We want to be about a 3 out of 10 or less. We're looking for minimal soreness after you perform the bench press. So let's say you go to the gym, you pick a bench press modification, feels pretty good, 3 out of 10 at pain at most, but that night you're super duper sore, super painful. It was probably a little bit too much, right? We're also making sure that there's minimal soreness the following day. So again, if I'm bench pressing and it feels pretty good, but the next day I feel terrible, that was probably too much stress as well. We want to make sure there's minimal soreness during, after, and the next day, right? And the last piece, and this is probably the most important, is that you really want to look for progress from week to week and month to month. So if you're pushing through a decent amount of pain, but you're finding that your strength is going up, your pain levels are going down, you're using more challenging bench press modifications, you're moving in the right direction, okay? And here's reality. Some folks are going to be able to get away with minimal modifications and continue training. Some will need more drastic modifications, and a small subset may need to completely eliminate anything that resembles a bench press. This would be your very, very serious injuries and post-surgical patients, obviously. But for the most part, we keep most people doing some version of a press that's looking a little bit like a bench press at least, right? So, step 1, when we're trying to modify the bench press, is we first try to attempt to modify the load, right? And we can do this through a variety of different ways. And the reason why we do this is because of most folks that have shoulder pain in the bench press, the big thing they don't tolerate is going to be how much weight's on the bar. It's super common for a patient to come in to see me and say, you know what, my shoulder hurts when I bench press, but it really only hurts when I get above 80% of my 1 rep max, all right? And here's the thing, if we keep them below 80% of their 1 rep max, they can probably train all day and feel great, right? So for that person, that would be a phenomenal modification. So how do we attempt to modify loads? Well, there's a variety of ways to do this. One very simple way that I use quite often is to reduce the RPE, or the rate of perceived exertion. So basically, how hard do you feel like you're pushing your sets on a scale of 0 to 10? 10 out of 10 is basically, a train ran over your mother and you have to deadlift the train off your mother to save her life. You're going to use 10 out of 10 effort, right? 0 out of 10 is you're doing absolutely nothing. For most folks, they probably train somewhere between the 7 and 9 out of 10 range, if I had to guess, right? But we can very easily just go down a notch, right? So if I normally train at an 8 or a 9 out of 10, how would I cut that down to a 6 or 7 out of 10, right? So I make things just a little bit easier. I decrease the load. That's oftentimes to get enough to get away with training for the day and feel pretty good about it. Right. And I actually just released a podcast about this last week, but if you train to failure versus you take a few notches off the intensity scale, you have very similar improvements in strength and size. So it's, when people do get hurt, I think it's important they understand that, because oftentimes they feel like they need to push as hard as they possibly can to continue progressing. But oftentimes we can take a few notches off the intensity, take a little bit of weight off the bar, and proceed at the same exact rate. All right. So make sure you tell your patients that if they don't know that. The next thing we can do to modify load is to slow down the movement. This is where I like to use tempos, right? So let's say I'm bench pressing for the day. My shoulder is bugging me, right? So I'm going to try to slow it down and see if that decreases my pain. So I may have a 2 count on the way down. So bar is completely locked out. I unrack. I go down on a count of 2, 1, 1,000, 2, 1,000. No pause at the bottom. I come up on a 2 count, 1, 1,000, 2, 1,000. And I just go up and down at the 2 up, 2 down tempo. And here's what happens. When you do a tempo, you have to knock some weight off the bar, right? There's more time and attention. It's more challenging for the muscles just because they're working for a longer period of time, and you simply can't lift as much weight. So it's actually a pretty good way to continue getting, a strength benefit and a hypertrophy benefit, getting some good time and retention without irritating the joint, right? And the other thing you can do besides just a tempo, and in reality this is a variation of a tempo, but just adding a pause. Oftentimes in the bench press, I'll just tell people, give me a 1 second pause at your chest and a 1 second pause at lockout. And that's enough for them to have to slow things down enough that they have to knock some weight off the bar, and then they may be able to train just fine for the day. So that's another option. It's something you can try. And the last one, and this is one of my favorite ones to try, is just to increase the repetitions, right? So let's say you're supposed to do a 5 rep max today, and that's maybe 90% of your 1 rep max or something along those lines, right? That might not feel very good. But I'll tell you what, if I tell you, hey, instead of doing a 5 rep max, try a 12 rep max, right? And now all of a sudden someone's using like 75 or 80% of the max just because you simply can't do 12 reps with 90%, right? So we knocked off 10% off the bar weight-wise, and you often will find that people can tolerate the bench press really well, right? And over the course of time, obviously, we can progress back to the heavy lifting, but for the day, we can survive and potentially help heal the shoulder by decreasing some of that stress via increasing the reps. Okay. Now, what else can we do? Let's say that you're supposed to bench press for the day and you try to modify the speed, you increase the repetitions, everything's feeling like crap, right? What do we do next to try to continue training? Well, what I'd like to do at this point is to attempt to find a similar movement, right? And you're looking for a movement that's very similar to the bench press. So we're looking for a movement that maybe trains the pecs, trains the delts, trains the triceps, trains all the pressing muscles so we continue to make progress over the course of time, right? A couple mistakes I see from patients when they come in, they'll say, hey, bench press was hurting, so I stopped all upper body exercise in the gym. And in my mind, I'm like, wow, that was a big time mistake because you probably could have gotten away with like 90% of the movements in the gym, right? And you could have gotten the benefit from 90%, but instead you decided to stop everything, right? And I think another mistake is people will say, bench press hurts, so I took out all bench press and I just do a lot of rows instead because I heard that was good for my shoulder. Now, I think rows are great for your shoulder, but I don't think that you should make the jump straight from bench press all the way to row, just because a row is using completely different muscle groups, right? So A, we're not working towards our goal of building pecs, building shoulders, building the pressing muscles, right? And B, we're not putting stress on the right tissues anymore, okay? So that kind of violates those initial priorities that we're talking about. So what do we do in terms of modifications? Well, I make a lot of these modification ladders, and what these ladders are a series of exercises, and they go from the most challenging exercise for the shoulder all the way to the easiest exercises on the shoulder, all right? So taking a look at this modification chart right here, all the way to the left, if bench press is bothering you, right, and you tried to modify the speed or the reps and it's not working, then you can try a close grip bench press, right? Oftentimes changing the grip is enough to maybe offload an irritated structure in the shoulder, and all of a sudden you feel pretty good. You can also try a floor press, and what this does is it shortens that range of motion, right? So again, we're probably not stretching the front of the shoulder, giving that example earlier, if people have, let's say, anterior instability, and oftentimes you can get away without any pain. And the last one is trying to change the angle. So trying, let's say, an incline bench or a decline bench. I'm not exactly sure why it helps to change the angle, but my thought is that it probably offloads certain tissues, certain structures in the shoulder, and people end up feeling A-okay, right? Let's say none of those are feeling very good, right? You've tried all these, they all kind of hurt. What do we do next? Well, the next variations I like, they don't look like a barbell bench press anymore, right? We're starting to see different implements. So we have a landmine, we have some dumbbells, we're using our body weight, but we're still pressing, right? So we're still working similar muscles and we're still stressing similar structures because the stress is what heals things. So these are oftentimes pretty good ideas. One of my favorites is going to be a half kneeling landmine press. So basically you have a landmine set up in the corner, you've got one knee on the ground, 1 foot on the ground, and you're pressing overhead, right? Another good option to try is dumbbell bench press. So dumbbell bench press does a few things. One, you can't use as much weight because it's unstable implement, and because of that, it knocks the weight off of what you can handle. Two, it changes the grip a little bit, so you're a little bit more in a neutral position as opposed to pronated, right? Which a barbell forces you to do. And the other piece is that if you have kind of a larger dumbbell, you might not be going quite as deep, because if you're doing a dumbbell bench press, obviously you can moderate how far down the dumbbells are going, but the dumbbell is going to hit your chest, and usually it's going to touch your chest at a higher depth than a potential barbell would, because a barbell goes a little bit deeper. And last, you can try a push-up. Push-ups are interesting because they allow the shoulder blade to move freely. And I don't know exactly why push-ups can potentially feel better than a bench press, but it might be one of the reasons why push-ups feel great when bench press feels terrible, right? Oftentimes, for a lot of irritated shoulders, they're really not going to be able to tolerate much of any pressing variation. And if that's the case, I usually resort to trying a few different crawl variations. So a forward crawl as well as a backwards crawl. I also like to try lateral crawls. And then lastly, you can try a shoulder tap. So even folks that are very irritated, they can oftentimes get away with some of these movements. And again, we're not pressing, but we are working similar muscles. So I think that's decent. And the last thing I would try, if everything else fails, if everything feels terrible, then you want to try to substitute a rowing exercise in place of a pressing exercise or all of the other movements I just talked about. So I really think it's a last case scenario, and it's fine to do this, right? It's okay if you need to, but I would try all these other variations before I'd go to the row. Okay, let's bring my face back. Right? So a really good honorable mention that I use a lot with my patients is blood flow restriction training. And if you haven't tried blood flow restriction training before, it is taking a blood pressure cuff that goes around your upper arm, right? So at the very bottom insertion of the deltoid, it kind of goes right around that area, as tight up around the armpit as you can get it. And then you will restrict the amount of blood flow to that area. And when you exercise, you get some cellular swelling, and you also get lactic acid buildup. You have more hydrogen ions in the area, and it burns, right? If you're using blood flow restriction training, it's not allowing those to leave the area as fast as they normally would, okay? And the swelling, as well as the acid, is thought to create the failure within the muscle, right? So because you have the blood flow straps on, the muscles fatigue much more quickly than they normally would. And because of that, you don't have to use as much load in order to get the training effect. So you'll get more improvements in strength and hypertrophy without the same loads, right? Typical strength training, you're needing 80% more of your 1 rep max. For blood flow restriction training, you're only using 20% of your max. So if I'm not tolerating very much pressing at all, maybe I'll try a really light pressing variation, 20% of my max, and just do lots of repetitions, okay? And this is a phenomenal way to continue training, right? I did read one study, and I can try to find the link for you guys, but it was in powerlifters. And what was interesting is that they had 12 weeks of training, and this was for the squat, right? So it wasn't for the bench press. But what they ended up doing is one group took a 4-week block of their 12-week training period, and all they did was blood flow restriction training, right? The other group just did 12 weeks of regular training. And at the end of the 12 weeks, they retested their 1 rep max. And what's interesting is that they all made improvements. So both groups made improvements, but the blood flow restriction training group made the same amount of improvement as the regular strength training group, which is amazing because if I have an injury, right, and I need to take 4 weeks off from heavy training, I can actually make the same amount of progress than someone else that trained heavy for those 4 weeks, all right? And that's pretty amazing, right? So that's another really good modification you can try before going from a press exercise to a row. Okay, what is the next step? We're going to need to strengthen the shoulder. And where are we focusing? So where focus is going to be on the injured area and the helper muscles for the bench press. More often than not, I think the most common injured area that I see, right, and again, I'm just guessing, right, these are all anecdotes, is going to be the rotator cuff. I think most people are dealing with some sort of rotator cuff tendonitis, tendinosis, partial tear, something along those lines, right? Certainly could be something different, but I do think that the cuff gets irritated quite frequently, right? So this is a decent example. Now, what are the helper muscles for the rotator cuff in the bench press? Well, you have the serratus anterior, your pecs are obviously producing force, the delts, the triceps, all of those muscles are going to help produce force for the bench press. And what we want to try to do is build a balanced program. So not only are we focused on the pressing muscles in the rotator cuff, we're also going to focus on the lats, traps, biceps, and upper back. So you just want to have a nice comprehensive strengthening program and make sure I target the injured structure, okay? I don't want to completely eliminate all training that aggravates it. I actually kind of like the idea of stressing a little bit. So that being said, what are the best rotator cuff exercises for shoulder pain during the bench press, right? And we talked about this a little bit previously, but why am I concerned about the rotator cuff in the bench press? Well, first and foremost, it's a potential source of pain, all right? And if you start looking through our medical literature, right, on the bench press and what the most common types of injuries are, you'll see tendonitis being one of the first ones, okay? And which of the rotator cuff muscles do you think gets aggravated? Well, generally speaking, the supraspinatus and the infraspinatus, so the top and the back part of the rotator cuff, most often have tearing over the course of time, right? Can you tear the other ones? Of course you can. But generally speaking, the supra and the infra are the most common injuries, okay? So here's the other thing that's important about the infraspinatus and the supraspinatus. Infraspinatus maybe even more so. So when you bench press, you will utilize your pecs and you're going to use your delts, okay? They attach on the front of the humerus, okay? So when they contract really hard when I'm doing a bench press, that's going to pull the ball anteriorly or forward in the socket, all right? Now, the infraspinatus sits on the backside of the joint and it has to fire with equal force as the pecs and the delts to keep the ball centered in the socket, all right? So I want to try to stress the rotator cuff, so I want to stress the infraspinatus and the supraspinatus because A, they're probably one of the injured structures, and exercise is going to heal that structure. And the other part is that the infraspinatus is what controls motion within the joint when I bench press. So it makes total sense that I should be focusing on these areas, right? So one of my pet peeves when it comes to rehab of the shoulder, and this is more, I think, popular in the strength and conditioning world, right, and also in the social media world, not necessarily in the physical therapy world, is that when folks have shoulder pain, they think, I need to do more rowing. I'm not doing enough rowing. I need to really increase the amount of rowing that I do, right? Now, I don't think that's a bad idea, but I don't think it's super accurate, right? And the analogy that I give people, especially the students I work with, is that let's say you have Achilles tendonitis, Achilles tendinosis, right? And you're trying to get that person out of pain, right? What do you give them? You give them calf raises. We directly stress the Achilles tendon, right? If someone had shoulder pain and you told them, I need you to stop pressing, I want you to start rowing, that's the same as telling your Achilles patient, I want you to stop all calf raises and I want you to do tib anterior raises all day long, resisted dorsiflexion, right? Now, obviously, that doesn't make any sense, okay? So what I'm getting at is that if you have shoulder pain in the bench press and the rotator cuff is involved, we need to directly stress that in order to make progress over the course of time. Yeah, sure, keep your rows in the mix. Rows are not going to put so much stress on the shoulder. You can probably train those heavy, but make sure you train that part of the rotator cuff and also your pressing because that's going to train the rotator cuff as a byproduct. Okay, so I already said this before. During the bench press, the pecs and the anterior delt are going to be prime movers, right, for the bench press. They're firing aggressively. And what that's going to do is pull the ball forward in the socket, anterior translation, and the posterior cuff, which sits on the back of the ball and socket joint, infraspinatus, has to fire aggressively to keep the ball in the socket. And we have some research about that. And there's, this research study that I'm quoting right here. They put people in a chest press machine and they measure the EMG of the rotator cuff, right, and also the pressing muscles. And what they found is that when you do a bench pressing motion, your infraspinatus is very active, but the front side of the rotator cuff, the subscapularis, is quite quiet. And if we flip it and do a row, the infraspinatus is now quite quiet. So rows are not good rotator cuff exercise for the infraspinatus, right? But the subscapularis EMG goes way up. So when you do a row, the front of the rotator cuff is very active, subscap. When you do a press, the back side of the rotator cuff is very active, infraspinatus. So, I think this is hilarious, I hate rotator cuff exercise. I'll just say that. They're so boring. I feel like you're not accomplishing much of anything when you're doing rotator cuff exercises, but they're so freaking important. And I tell people that they need to eat their vegetables. What I mean by that is that no one likes to eat vegetables, but we know that they're really good for you, so you got to do it, right? You got to eat your broccoli, carrot, salad, all that stuff. That's healthy for you. Working your rotator cuff is kind of the same way. And I think oftentimes people get way too fancy with their shoulder rehab when they need to really stick to the basics. So what are my favorite rotator cuff exercises for shoulder pain during the bench press? It's the basic stuff. It's a sideline dumbbell external rotation here. Great EMG of the infraspinatus, okay? It's a tall sitting dumbbell external rotation. So basically, Kiefer over here is doing a side sit. He's got his elbow resting on his knee here, and he's doing external rotation, internal external rotation with a dumbbell. One of the reasons why I like this exercise is because we have the shoulder sitting a little bit, or excuse me, the elbow sitting at about the same angle as the shoulder, which is going to mimic very similar forces that you're going to see in a bench press. Obviously, when you bench press, your elbow is going to be more or less level with the shoulder, a little bit down towards your side a bit, depending on how wide your grip is. I'm also a very big fan of 90-90 band resisted external rotation. I like to have the elbow a little bit higher, again, because I think it more closely resembles the bench press, right? It's also a little bit more challenging on the shoulder than a typical sideline dumbbell external rotation. And the last one is a dumbbell scaption. The reason being is because it is a phenomenal exercise to isolate the supraspinatus, which again is the most common tendon that gets irritated in the shoulder, right? And especially during bench press. So now we have the rotator cuff stuff covered. What else do we need in a bench press program, right? So first and foremost, it just needs to be well-rounded, okay? So you're doing your modifications for the bench press, right? You want to pick modifications that are as similar as possible to the prescribed exercise and set and rep scheme of the day that you can tolerate well with minimal pain, which for me is usually about 2 times per week. I'll do some sort of bench press variation. Additional rotator cuff strengthening should occur about 3 times per week, right? And then you want to make sure you incorporate a lot of other exercises for the shoulders, scapular stability, so posterior delts, rhomboids, upper trap, mid trap, low trap, lats, all that good stuff. If you want to see an entire sample program, I have them for the bench press in Fitness Pain Free Insiders. I have a sample program for someone who has shoulder pain that's trying to get out of pain and back to bench press. I'll put the link in the bio. It's $1 for a week trial if you just want to check it out and download the sample and cancel. I'm okay with that, but hopefully find extra value beyond that.